Today we'll talk about the long haulers and the people who are still suffering from some symptoms, and we call them also the long-term COVID symptoms. And these are some 5 or 6 symptoms which some people are still suffering from, and now it's more than 17 months from the beginning of the pandemic, and some people are still suffering from these symptoms. They are still feeling these symptoms, which I classify them in 6 or 7 groups. That the first one is the most common. In the most common symptoms, the most common adverse reactions of COVID are the fatigue and tiredness. Fatigue, more than 60 to 70% of the people who had contracted the virus are still suffering from the weakness, and also they are still tired and fatigued and so. And the second group is that people who are now suffering also from some shortness in breathing. And the shortness in breathing, so 40%, 30 to 40% of people who had contracted COVID are still suffering for this symptom. And the third group is the headache. A lot of people now are also some headaches and headache, but when you have a headache that you cannot work, and you should have other troubles with the headache, and also the brain fog. Some people may have the brain fog. They cannot concentrate. They get tired when they concentrate, and they have now, the brain fog, that things are not clear. But some other symptoms also may represent some 5 to 10% and more in some countries, such like the loss of the taste and the loss of smell, and also some diarrhea and some coughing, and so. These symptoms that a lot of people has had their taste changed. That the food tastes not like before, and they are getting now a bad taste from food, or a bad smell or odor from food. So it's abnormal. These things are not usual, and these long haulers that some physicians and doctors in some countries like United States and in Europe now begin to treat these people with some physiotherapy, exercise, and giving some medicines, and helping people to live with, at least to getting rid of these long-term symptoms, long-term COVID symptoms. So in our countries we have less, the percentage is low compared to the American countries and also the European countries. So now the situation is getting better in these countries, in our Arab and Muslim countries. Anyway, that for these symptoms, that we will help people, that we should talk about something which is positive for people, and we should help people, not talking about a topic and discussing with now results, and right now, our goal and our target is to help people and to show also to people how they should manage themselves, and how they should take care of themselves by themselves. That's one doctors and physicians can do, they will do it, sure. And some hospitals and some, all the health care providers now are working hard with these long haulers. But that these patients may also do a lot of things at home, and they should practice some, like exercises or sport, and so that. The first point for these people, because a lot of people cannot stand up and cannot walk, and many people cannot stand up and cannot walk. How these people can do exercises or some, gymnastics or a lot of things. But the walking or jogging or swimming or doing any exercise, any physical effort is very good for these long haulers. The first point, sport or exercise that you should move. Even for people who cannot, they can use some cans, or they can be helped by some anything. Even that the old people can be helped by other people. Now, why not? And so that exercise and the physical effort is very important in this phase. So, and the second point is hijama. I talked about hijama, the cupping therapy, and the cupping therapy now is being practiced in all the countries. The cupping therapy, hijama, they should have at least 1 or 2 sessions, but for some adverse and for some symptoms, they should have more than 2 sessions, but they should be spaced by 2 weeks or 3 weeks at least between each session. Anyway, some symptoms now are, we are getting some adverse reactions from the vaccination. The vaccine also, but we will talk about the vaccines in the next live, but today we talk only on the long haulers and the people who are still suffering after 17 months now are still suffering from these symptoms from COVID long term. We call them the long term COVID symptoms. So the first point is exercise, and the second point hijama or cupping therapy. This might help people. We are talking about some practices that may help people. So that we are not giving solutions or medical solutions now. We are giving the extra medical solution. Sure, that people will go to the hospital, will go to their healthcare providers, sure. But what we want people to know that there are a lot of things that they must do and they can do. Why not? And so they will not stay without doing anything. That it doesn't make sense that you are sick and you should look and you should seek for anything that can help you. And that exercise, hijama or cupping therapy. And the third point is fasting if you can. For people who can fast, why not? Fasting or starvation, to practice a starvation. The difference between fasting and starvation, that when starving you can drink water. But fasting is something that it's limited by time, and no drink, no food, nothing. So, and the fourth is a vegetarian diet. That people these people may shift to a vegetarian diet, not vegan, vegetarian. Why vegetarian? That they can eat fish. That's because fish is rich in omega-3, vitamin D, vitamin B12, selenium, zinc, and iodine, and other minerals, and other vitamins and proteins. Fish is very rich in proteins, but there is no saturated fat and no cholesterol in fish. So the vegetarian diet plus fish, and also these people should avoid the other causes of the diseases. You know that the autoimmune diseases now are caused by some food additives and food chemicals and chemical compounds which may exist in food, and especially in processed foods, and also the way the food is cooked may generate some toxic and some poisonous compounds like acrylamide, like some melanoids, like peroxides, epoxides, and a lot of chemical compounds that can be generated only by the way the food is cooked. So, and people should pay attention. These people, we are talking about the long haulers. So people are sick and they are still feeling these symptoms, and they should pay attention to their diet. So the vegetarian diet plus fish, instead that they should replace meats by fish. This is a balanced diet, that because we have proteins, fibers, minerals, vitamins, antioxidants, enzymes, and all things in the vegetarian plus fish. It's a complete and it's a healthy diet. So these people should avoid meats, all kind of meats, including poultry, because of the saturated fat and because of the cholesterol, And the cholesterol may render the blood a little bit thick, and the blood circulation will be delayed by too much proteins in meat, and also the fat in meats, fats, and cholesterol. And also the dairy products, if they cannot avoid also the dairy products, it would be better for them. And all processed foods. Why? That because processed foods may contain some free radicals, and also processed foods may not contain some, beneficial materials like in food, because the processed food is sterilized and vitamins are destroyed and some factors are being destroyed. But processed foods is also cooked by the refined oils and also by hydrogenated oils, and these processed foods may contain some food additives, and food additives may trigger all these diseases like autoimmune diseases or any other like cardiovascular disease and so on, and also the gut and your gut. So that avoiding the meats and dairy products, all the animal sourced foods, so poultry, meat, and also the processed foods also, and fried foods, and sugar, no refined oils, no meat, no dairy products, no processed foods, and no fast food also, and junk foods like candies and like some soft drinks and so ice cream and so on. For these people, for a short time, at least 1 to 2 months, they will check their health. If they get better, they can continue and they can change their diet, and also they can do all things that they should do to help themselves before getting rid of these symptoms of them. Because you know, if these symptoms would stay more than 1 year or 2 years more, sure that we can get other autoimmune diseases, or we don't know. But now we are observing that all the researchers around the world and some doctors around the world now are observing, they are noticing that there is an increase in some autoimmune diseases like Guillain-Barré and like systemic lupus. These two autoimmune diseases now are increasing just with the COVID. And I don't know, so some other autoimmune diseases can be, because that the triggers of these diseases may exist in this kind of foods, and you should avoid this. First point is exercise. Second point is cupping therapy. If you can do it, I think that in all the countries, it may exist in all the countries, but I think in the Arab countries it's better, that because all the people know what does it mean, hijama. And also in the Asian countries, in India there is a practice of all the people, they practice the hijama, the cupping therapy. So exercise, cupping therapy, and so fasting or starvation if you can, the diet, the vegetarian diet plus fish instead of meat, and avoid meat, all the animal sourced foods with the processed foods also, and also the fried foods and sugar and the refined wise, hydrogenated wise, and all these things. That's only clean and healthy diet. A clean and healthy diet may help these people, that even under the treatment, that because now doctors and physicians now are giving some medicines and they are trying to help these people and to treat these symptoms and to see and to check with the blood analysis and the determination of blood of some factors, so they can know why these people are getting these symptoms. So this is a food plan, a diet plan for these people. But if you can get some food supplements also, and these food supplements are not medicines, they cannot be substituted to your treatment. But there are some food supplements only. These things may help you getting rid of these symptoms. Sure, a lot of people now, instead of doing nothing, why not try? You should try with these things that you will not lose anything. They are natural, that you can do it, and so why not? Why not? Huh? So, and just to do something, that you should do something. They should not wait until you are feeling your symptoms, you are feeling that you have a headache, or you have a brain fog, or you have some fatigue or so, and you don't do anything. That, you know, it doesn't make sense. That you should do something at least to help yourself. And some food supplements like royal jelly and propolis, and these two things also are very good, and they may help people, like royal jelly and propolis. And some people can develop an allergy to propolis. They have to check with their doctors. So propolis and royal jelly in the amount of 1 gram to 2 grams per day of propolis and 1 gram of royal jelly per day. And some plants also, why not to drink some tea or infusion tea from some plants, like moringa, like ginseng, ashwagandha, like ginkgo biloba, like a lot of things that you can find in your country and things that you can buy, that because some food supplements are expensive. That's what you can buy in the country you are living in. And so even other things like some saffron and some olive leaves that you can get some caps. I think that all the countries now may have some caps of olive trees, olive leaves, caps, and also all the leaves of trees. If you can find them around you, that you can use them. A lot of them may exist in any country, that you will find them, sure. And also the green tea, the ginger, the galanga, the cinnamon, also these things, also you can prepare a hot drink and drink it, that it may help that, because you should have the right amount from the antioxidants. The most important and the most strong factors that may help these people are the antioxidants, that you should have a diet rich in antioxidants, like chlorophyll, like flavonoids, like polyphenols, and also antioxidants. You should get antioxidants, a high amount of antioxidants, and also the omega-3. Omega-3 may help. That omega-3 also may participate to many good reactions in your body, physiology. Omega-3, antioxidants, omega-3, and also a high fiber diet. But your diet, if it's a vegetarian diet, sure you will get a high content of fiber in your diet. And also the food rich in vitamin D and vitamin C. Fruits and vegetables, and also fish is rich in vitamin D. And also some fatty acids like olive oil. Olive oil is rich in oleic acid, and oleic acid is the unsaturated fatty acids may help your cardiovascular system. So olive oil and all sources of omega-3, and also the antioxidants and sources of vitamin D and vitamin C. And these compounds may help these people, but at least that you are now feeling, you are still feeling the symptoms of COVID, and you should get rid of them. But these things may help you, sure, they may help you. For the people who had contracted the Guillain-Barré, it's it existed for all the vaccines, and it can be caused by bacteria, virus, by vaccine, by any causes, many causes. And Guillain-Barré, it's not new. It had been usually existed for. And for people who had contracted Guillain-Barré, they should pay attention, and they should use. It's mandatory for the people with Guillain-Barré, royal jelly and propolis. Royal jelly and propolis, that because you have some dopamine and you have some melatonin and you have some beneficial compounds in the royal jelly and in the propolis. Propolis is rich in antioxidants, and royal jelly may contain the dopamine and some other compounds. That propolis is 300 chemical compounds. And these Guillain-Barré, especially the Guillain-Barré, they should avoid meats and processed foods, and they should eat only vegetarian diet. This fish is very nice, very sufficient for your life, for your body. But they should take royal jelly and propolis. That these may not have any side effects, even if you are taking some medicines. No problem. No problem with these food supplements. Even if you take some medicines, some chemical medicines, it's not a problem. That's because these compounds are natural, and these food supplements can be used even with the medicines and with the treatment that your doctor can prescribe to you. That go and you can try to look for these things and to get them, and you can use them with your treatment. It doesn't disturb, it doesn't, it's not a problem, because they are natural compounds, they are natural products. Anyway, these long haulers, they should, sure, they are now, they should have a check at least, and blood analysis and some, imagery for some organs and so on, but they are now, as I said before, that now physicians and doctors now are now treating these long haulers, and some medicines are being given, and they are trying to help these people with exercise and with some other. That now we want to help more and more with this treatment, with these procedures, modern procedures, why people that do not do any other practices that can help, like exercise, like starvation, like copy therapy, fasting, and food supplements, and the diet, clean, healthy diet. That it may help, sure, it may help, and you can use everything that can help you, that you can look for it, and go on the net and check with these things, and you will find that they are very good for all the diseases, not only for these long haulers, for all the diseases, even for other the cardiovascular diseases, or allergy, or asthma, or the gut, the problem of the gut. So these people should at least think of the gut. Why that? Because when your gut is lazy, you will not get sufficient factors for your energy in the body. The absorption in the colon is not, in the bowel is not good, and that you should have the probiotic. It may exist in tablets or in your pharmacy, but ask in your pharmacy. You can also discuss with your pharmacist about this probiotic. You should take probiotic with every meal, 2 or 3 times a day. And also you can also ask your pharmacist about royal jelly and propolis, and also these things that you can find in caps, or I don't know. So you can find them in the pharmacy, in the green pharmacy, or that you can find them, sure. And they are now controlled. They are controlled, and they are, the concentration is indicated, and everything now is clear to people. It's not, you will not take them as raw from the nature. So hope that these information, at least, or this advice, and can help you, and sure that if you can take a pen and write these things like exercise, cupping therapy, fasting or starvation, the diet, clean, healthy diet, and only home-cooked foods, and avoid meats and all animal-sourced foods, and avoid all processed foods, and also no sugar, no refined oils, no meat, no dairy products, nothing. So, and then go to food supplements, and also some drinks, some hot drinks like tea, some infusion from many plants that you can use. And these things, as I said, they are not, they are not medical solution. They are not only the food solution, and also why not so take the advantages from these, the health, some health benefits of these foods and kind of foods. And you should now, the high fiber diet is a vegetarian diet. It's easy to understand that high fiber diet is a vegetarian diet. The vegetarian diet is very high in fibers. And fibers are very important for your body. But more than that, try to get food rich in antioxidants. If you cannot, you can buy the antioxidants as food supplements in caps or in powder, or so that you can find them at, but you should not ignore the antioxidants. You should not ignore the antioxidants. They are very important for your body, and even if you are taking some medicines or your treatment, and these things will not really disturb your treatment. They are natural, and they have no side effects or with your treatment. It's not this information and this diet. It's a diet plan for people suffering from the long haulers. We call them the long haulers. Unfortunately, now 17 months now from the beginning of the pandemic, and a lot of people are still feeling these symptoms. And I hope that you will get rid of these symptoms. Sure, you will have some improvement in your health. So just check with everything you can feel and tell your healthcare provider. Anyway, the natural procedure or the medical procedure, the modern procedure, anyway, anything that can help you, then don't forget it. But do not, take one without another. That you so that you are under the medical control, sure that you are receiving a treatment, but with this treatment that you can change your lifestyle, you can change and also have a clean and healthy diet. Try to have a clean and healthy diet, and you will see that you will see and you will feel the improvement in your fight, and inshallah, hope that you will get rid of these symptoms in a short time. Sure, you will get rid of them, but we hope that it can occur in a short time. This is very important for people suffering with contracting the Guillain-Barré. The Guillain-Barré is easy to diagnostic, and your doctor will tell you that you have Guillain-Barré, and Guillain-Barré it would depend on the immunity of the body and so on. When you feel weak and tired and so, check with your immunity. That's for people who are suffering from anemia or a low count of the platelets or the white blood cells or some problems, but check with your lab determination, with your analysis. And also some other diseases can have the same symptoms. You know that people suffering from the liver diseases or some kidney diseases and so on, they feel that they are tired or they feel fatigue. They have a fatigue, or some other people may have a headache, sure, but because when the cause it's from COVID and people, that's the recovery now. We hope that the recovery will be done, but some people now in 17 months and there is now recovery from these symptoms. But I hope that it will be done. Inshallah, it will be done in the next weeks or in the next months. Why not? So. And I cannot imagine that people can suffer from these symptoms for more than 2 years or 3 years. We don't know. Some other diseases can appear with these long haulers in these long haulers. Until now, the problem is not really so. It's not worse, but I hope that it will not be worse with time. We need from 2 years or 3 years and so on, and hope that people can get rid in a short time with these information and these advices for these people, the long haulers. And you know that around the world, in all the countries, they don't talk about the diet. You know, they don't talk about the diet. They are ignoring the diet. They are ignoring the lifestyle and the way you are living in your house. And this is also my help in the treatments, my help in the healing procedure you are following. And there is a medical procedure you are following, sure, but you can do you can add some other factors, and then you can, accelerate your healing. So why not? But I was told that even in the European countries, like in Great Britain or United States, in Canada, in Australia, we have some friends from Australia that I get a lot of messages, but they are not taking, really, they don't take in account the diet and the lifestyle and the things that people are consuming. But because there are a lot of chemicals which may trigger these symptoms and will stay there, like some allergies or some asthma or something like the smell. People who are now losing the smell and the taste. So they should have checked with their doctors with the allergy or the asthma or some other. And people who are now who had taken for a long time the corticoids, you know that they can lose the smell and the taste. But the percent now of people now who are not losing, so that the taste and the smell not are high. But before it was less than 1.1, then 0.1% for people suffering from the asthma or the allergies. But now it's among the symptoms, the long-term symptoms of COVID, the loss of smell and taste. Anyway, this plan, I hope that will help you in this for the recovery from these symptoms and the recovery. Hope that the recovery from anything, not only, and it's also good for other diseases that people were suffering from the other diseases, and then with the COVID, that the health is worsened by the COVID. And so even the autoimmune diseases or the cardiovascular diseases, the gut diseases or diabetes or hypertension, and so the anemia and a lot of them, that these things are also good, and in the same time these advices are good for these diseases. And so that because the diet, when the vegetarian diet, too much fiber and antioxidants with fish, that you will have a clean, healthy diet. And so if white sugar, refined oils, and processed foods, that you will not get some source of free radicals. And the free radicals may destroy also your immune system, and also it might also irritate your microbiome, and also the friendly bacteria will be destroyed, and your gut will not function normally, and so the absorption will not be done, and you will not get too much energy, and also the absorption also mineral like magnesium, calcium, iron, and so on. And then that other causes also can be also done in the same time with the COVID symptoms, and then some people were suffering from other diseases before contracting the COVID. But I think that this plan it's well done. It's well done. So that I worked on this plan for years and years. That advice for all the diseases, and this is the right diet. The right diet and the healthy and clean diet and the right way, so to help yourself beside the medical procedure, beside the medical solution. It's not a substitution for the medical solution, but beside the medical solution, these things might help you, so getting rid in a short time, or also the recovery will accelerate also the recovery from these symptoms, inshallah. Hope that will the recovery will be done or will be occur in only few days or few weeks, at least, inshallah. See you in another live. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.